Hi everyone, welcome back to my channel. This is Dr. Ashwini. I have passed my DCH exams this year and I would like to give you some tips for attending your theory exams. So the most important question, when do you start your preparation? Well, it's ideally from the day you join the course. You learn something every day. For the first year PG, the initial 1 month will be for adjusting with the surroundings. But please don't take more than 1 month's time as our exams occur within the 2 year periods we are time. The next question is about the study materials for preparing for theory exam. Like a Nelson textbook of pediatrics, this is our Bible. You must study it and make notes from it. There's no shortcut. I have to see the previous year questions, mark them in Nelson textbook, and write notes. For NIC and PIC topics, use AIMS protocol, working book for immunization. You can also read journals from Indian Pediatrics, IGP, IJPP. YouTube lectures can be used for better understanding a topic. You should also go to the last 5 years question paper of BNB and DCH, and yes, mark them in Nelson textbook and make notes. Just before exams, ideally you should revise your own notes. You can also buy soft question paper books. This will give you information on how to present an answer in the exams. YouTube video lectures will save you a ton of time when the exams are here. The most frequently asked question is how much time to study per day. You should try to study 2 hours every day and write answers to 2 questions from the previous year question paper every day. And when exams are nearing, you can increase the time to 8 to 10 hours every day. From which topic to start with? I would say start with the general pediatrics, finish off growth and development and immunization first. What are some most must-study topics? There are a lot of important topics. I'm just mentioning a few must-study topics. Neonatology, this is the most scoring topic. Study every topic that is in AIMS and IC protocol. This could fetch you a lot of marks. At least you will get 4 questions from the 3 question papers. From general pediatrics, study SAM, rickets, development delay, failure to drive, fluid and electrolyte, ADHD, ASD. From serious, study fetal circulation, cough, registry heart failure, and SVT. From CNS, study CSF circulation, neural tube disorders, seizures, febrile seizures, status epilepticus, syndrome, absence seizures, AFP, SMA, GBS, Adam and protein effect. From respiratory system, you should learn bronchial asthma management, STRIDER, cause and management, recurrent breeze, recurrent pneumonia. From GNT, you should learn hepatitis, congenital anomalies, celiac disease, cystic fibrosis, and chronic diarrhea. From nephrology, you should learn UTI, VUR, nephrotic syndrome, and AKI. From infection, dengue, enteric fever, rickettsia, and varicella. From emergency, you should learn the management of DKA, status epilepticus, status asthmaticus, and poisoning. From rheumatology, learn SLE, Kawasaki, HSP, and JIA. From genetics, you should study more of inheritance with 5 examples and pedigree chart, genomic imprint. From hematology, learn iron deficiency anemia, megaloblastic anemia, and thalassemia. From oncology, learn leukemia. This is a very important topic. You will get 1 question from this topic. From endocrinology, you should learn our short stature, approach and management, delayed puberty and perpetual puberty, CAH, and DM management. Other topics like IEM approach and POSCO are very important. Next question is, should one join a paid course or app? Well, this is a personal decision. I have joined a Prepladder app and also attended some dear madam's class. How many revisions before exam? Uh, the two would be best, but it's not possible in every case. So at least you have to do one time revision, that is mandatory. So what's the plan? Uh, we have exams before we complete 2 year period. So it will happen like 20 to 22 months into our training. So we really need a plan to start with. So I'm just giving you a sample plan. You can modify according to your wishes. The first month will be for adjusting with new surroundings. Well, but you can learn the drug doses and immunization technique during this period. The next 2 months you can utilize for studying general pediatrics. You can write notes and you can cover the journals. Neonatology can be studied during the NIC posting. 2 months period is enough for learning complete neonatology. 2 months can be used for learning CPS and respiratory system. 2 months for GIP and F4. 2 months for learning CLM and IEM. 2 months for learning hematology, oncology, and emergency. 2 months for learning infection, genetics, and endocrine. 2 months for learning rheumatic, skin, ENT, and other topics. And 1 month for all the backlogs. Now that's 18 months. And two important tips that I want to tell you is that always read about diseases that you saw on that day because there's a higher chance of retaining information. And always try to explain topics to your juniors and batchmates. This would serve as a revision tool. For revision, you have 2 to 4 months. It is very difficult to learn completely once in this time. So make notes and keep it ready for revision. What to do one day before the exam? Reach your center location. Eat healthy. I would prefer vegetarian food on that day. And when you feel anxiety or tense, talk to your parents or a non-medical friend. Sleep well and have a positive mindset. On the day of exam, arrive early at the center. Get excited and early. Be seated and please do not talk to anyone. The answer sheets will be distributed 5 to 10 minutes before the exam starts. Check the pages and if there is any damage, give it back to the invigilator. Fill the bubbles that is corresponding to your roll number. Take 2 minutes for doing this step because if you make some mistake, they will not replace the answer sheets. Draw side margins with a ruler and a pencil on both sides. Attempt every question. This is a very important step. Even if you do not know the answer, please write something. You will get half marks for just attempting that. Okay. Write neatly. Draw images or flowcharts wherever necessary. For listing or enumerate the cost type questions, best to write it vertically. Use headings and subheadings as necessary. Write what is asked for. They will not give you any extra mark for writing. And if they are asked for cost and you have written management, they will not give you any extra marks. Time management, this is the most frequently encountered problem. So you should plan ahead. Keep looking at the time after each question. Keep the last 15 minutes for going to the paper and do not spend a lot of time perfecting one question or drawing your favorite. So I would like to conclude my video by saying that you have worked hard for this exam and you will pass. Always have a positive mindset. So all the best, guys. If you like the video, hit the thumbs up button and do subscribe to my channel.